A common injury we treat with pickleballers is known as tennis elbow, or maybe at this point we should call it pickleball elbow. This is also known as lateral epicondylitis, which means there is inflammation and pain at the outside portion of the elbow. This is where the wrist and finger extensors and forearm supinator muscles attach. This can be commonly irritated with repeated motions, such as if you're dominating out on the pickleball courts, if you work on a computer with a lot of typing and using a mouse, as well as tightly gripping objects. So the first tip is to try to lighten your grip on your paddle during your intense pickleball games. To treat this, you're first going to take a tennis ball to massage through the muscles that attach onto the outside of the elbow. Relax your arm palm down on a table or chair. If you find a particular point that feels tender, known as a trigger point, you can spend extra time adding pressure to this point or even adding a little vibration as shown in the video. Next, taking a small weight, we are going to do eccentric supination. This means that the supinator muscles are working as they lengthen, which is used specifically to place a larger load on the tendon to help the tendon heal. To do this, you're moving your palm slowly down towards the floor and then using your other hand to help it back up. If you don't have a small weight, you can use a hammer or other household object. The next exercise, you're using that same eccentric concept. We are going to do eccentric wrist extension. Slow and controlled, you're moving your wrist down towards the floor and then using your other hand to help it back up. Next, try holding a stretch for the wrist extensors about 30 seconds at a time. This is a great stretch to complete throughout the day and especially during breaks during your pickleball games and practice. Finally, it's important to strengthen up the chain into the shoulders and upper back, including postural muscles, to help offload the strain in the elbow. These exercises can help if you're currently experiencing tennis elbow or to help prevent the onset of tennis elbow in the future.